Hello, today I'm going to be going over the 3M coding exercises. So I'm just going to go ahead and put, okay. Alright, so we'll start with number 1, and this is a morbidly obese male with coronary artery disease. I'm going to start with the coronary artery disease. I just typed CAD. They're unspecified, unspecified, unspecified. Do not wish to code. Okay, that one was pretty simple. I-25.10, and next I'll do the obesity. And for this one, I got a little tripped up at first because I coded the exogenous obesity, but it does say up here morbidly obese. So when I first did it, I coded it right here, but it says morbidly obese, so morbid, it's unspecified, do not wish to code, no counseling, no procedure. So E66.01. And next we'll do the degenerative joint disease. So I think I typed in, degenerative and then joint disease. And it does say multiple. And none of that. So it's unspecified. No procedures. So M15.9. And let's see. History of congestive heart failure. So you're just going to code it to congestive heart failure. And none of that. And no procedures. So I-50.9. Heart failure unspecified. And got AFib. Doesn't say anything else, just AFib. No procedure, so I-48.91. And it says history of myocardial infarction, and I'm assuming that means it's more than 4 weeks, so it's going to be an old myocardial infarction. Let's see, healed or old. Do not wish to code, do not wish, no procedure. So I-25.2, old myocardial infarction. Okay, so go to the next one. And let's see. I don't have to change anything, so I'm just going to stay on this. I'm going to start with where it says the ataxic gait. Ataxic and gait. It doesn't say any of that. So R26.0, ataxic gait. And then come down here and it mentions the cervical spondylosis. Okay, so let's see. Okay. And then it doesn't say what type, so hit unspecified type and cervical and no procedures. M47.812. And then it mentions the neuropathy, and it does say peripheral. So neuropathy, peripheral, and it doesn't say any of that, so it's going to be coded as polyneuropathy, unspecified. G62.9. Yep. Okay. On to the next. Let's see. There's nothing where I need to change the age on this one either. So go to the next. Let's see. Tired all the time. following diagnosis. Okay, so yeah, we'll just go from here. Hyperlipidemia doesn't specify. No. So E78.5. And then the coronary artery disease. I don't think any of this specifies anything extra up there that we need, so it's all just basic. CAD, unspecified. Do not wish to code. No. Oh, actually. No, that was a different one. Okay. Do not wish to code. I-25.10. And then you have the cerebrovascular disease. No, none of this. It's all unspecified. I-67.9. Then it says esophageal reflux. So, I'm going to hit GERD. Nope. Okay, K21.9. And then the anxiety, depression, do not wish to code. Other specified anxiety disorders, so F41.8. Okay. Let's see. Nope, nothing changed on this one either. So it says anal tear with hemorrhoids, so we're going to code the tear and then the hemorrhoids. So tear right here, other, and it's the initial. There's none of that, no infection, no external cause, and no procedure. So you get the S31.831A, it's the initial encounter. And then we'll do the hemorrhoids. Doesn't specify anything. So it's unspecified hemorrhoids, K64.9. Okay. Go to the next one. And nothing to change here. So, right orbital pain. So, eye condition, and it's pain, and right. So H57.11 ocular pain, right eye. And then you have hip pain, hip condition, pain. Oh wait, no, it's not the bone. Other unspecified, and right hip pain, do not wish to code. So pain and right hip, M25.551. And that's it for that one. So this one, nothing to change on this one either. And so it was referred by primary care. So that's the consult. Mono. I'll start with mono. Doesn't say any of that. Nope. No drug resistance. B27.90 for the mono. And pharyngitis. It doesn't say anything, so unspecified. Do not wish to code. Do not wish to code. J02.9. It's unspecified. Alright, so now the bilateral otitis media. So I'm going to go here. It does say media. Other. Bilateral. Do not wish to code. Do not wish to code. No procedures. So H66.93 for that one. And then, okay, so now procedures. So where it says she was referred to me by her primary care provider for further evaluation, I'm going to start with, an E&M code and other. It's outpatient. I'm going to do it by medical decision making, and according to this, it's low because there's not really that much going on. Do not wish to code. So 99243. I don't know why I put low. Let me read it. No, this one isn't low. There's nothing in here. This one was just straightforward. Okay, so let me go back. And consultation services. It's other. It's outpatient. Medical decision making. That's straightforward. Do not wish to code. So 99242. I don't know why I put low on that one, but let's see. What's next? CBC. Okay, so I'm going to do blood count, and then complete. Let's see. What's it? Let's see if it's complete. CBC. Okay, no. I think it's this one. Automated with automated differential. Let's see. No. Okay, yep. 850-25. It says blood count complete. Automated and automated differential white blood cell count. So, alright. And now, the sinus x-ray. Let's put x-ray. And I spelled it, I'm pretty sure. Yeah. Without. And it doesn't really say, so I'll put that. And 70210. Okay. So this one, I'm still under the male, so I'm going to leave it on male. And let's see, benign prostatic hypertrophy. So, hypertrophy, spell, prostate, and it's not specified, no malignancy. I'm not going to do the procedure yet. N40.0 for that one. And then cystitis. And it doesn't even say anything, so unspecified. No bacteria. So N30.90. Then we'll move to the procedure, the cystoscopy. Cystoscopy. And it doesn't say any of that. No accompanying procedure. It doesn't mention that. So you get 5,200. And that's it on that one. Alright, so this one, it does mention menopause, so I will go to next patient, female. I'm just going to put 50. And outpatient. Okay. So, diagnosis. So history of non-compliance, and then refuses to quit smoking. It does say nicotine dependent, so that means she was smoking cigarettes. Neurogenic bladder, lump found. Hemoglobin, fasting. Alright, so we're going to start with the diabetes. And it's uncontrolled, not being compliant. Let's see. I'm going to hit hyperglycemia, unspecified. No. Okay. E11.65, type 2. And then here it says lump found on breast self-exam right. So I'm going to put lump and see. Other unspecified. It doesn't say the quadrant, so right. Do not wish to code. N63.10, unspecified lump in the right breast, unspecified quadrant. That one got me a little bit because it does say somewhere about a specific, yeah, right here, follow-up of calcified cluster in the right breast, upper outer quadrant, but this down here is talking about her self-exam. So, let's see. Alright, so next, it says chronic small airway disease. So let's type airway disease, and this is chronic, unspecified, no asthma mentioned, and it's COPD, J44.9. Okay, next it says obesity. Obesity, and it doesn't specify anything. No counseling, E66.9. And then I will mention the nicotine dependence. Tobacco. And it was cigarettes, so she just wouldn't stop smoking. It's uncomplicated. And do not wish to code more. No toxic effect. F17.210. And we'll do the menopause. Doesn't say anything about it. Unspecified. Do not wish to code. Asymptomatic menopausal state. C78.0. Right here. And we gotta pick up the non-compliance with other medical treatment. It says non-compliant with follow-up, history of non-compliance. So it doesn't say why. So unspecified, risk factors, Z91.199. And the neurogenic bladder. Bladder, unspecified, no incontinence, N31.9. And go to the procedures. EM. I think this is why I mixed up the other one, because this one was low, not the other one. Other evaluation, outpatient. Other, and is an established patient, MDM, and this one is low. So he did do a few tests, no prolonged time. I'm not going to do the procedures right here. Wish to code. Okay, 99213. And then hemoglobin and lipid panel. So I think I might have done blood. Yep. Count hemoglobin. Okay, and it's 850.18. And then the lipid panel. I think I found that. Oh. Yeah. There we go. And then spell. I always like to spell it out. I just feel like it's easier. Lipid panel, and no more lab tests. It doesn't say. So 80061 for that one. And for number 9, let's see. Sugars are usually high. Left lower leg. Stasis dermatitis with 2 ulcerations in the region of the calf. Varicosity is present. Dependent edema, diabetes. Yeah, this one got me too because I missed the part where it said about the varicosities. So I coded it completely different. Let's see. Continue. Add diagnosis. So, let's start with the varicose. Varicosities. Did I start there? I think this was the lower limb with, because there is ulcer, and it is the left inflammation, and it does mention the calf. Okay. I-83.022. Varicose veins of left lower extremity with ulcer of the calf. So that captures all of that right there. But we do still need to do the edema. And it doesn't say any of that. So our 60.9, the edema. Next, diabetes. And it's uncontrolled. So uncontrolled. And sugar's usually high. Hyperglycemia. Unspecified, no complication. Do not wish to code. And that's E11.65 for the uncontrolled diabetes code. And then is an outpatient procedure. And other services, outpatient, other. And let's see, it's a established patient, MDM, and everything about this was straightforward. So, and the wound irrigation and all of that is included in the ENM, so that doesn't need to be coded separately. No prolonged time, no procedures, do not wish to code. Okay, so 99212. On to the next one, number 10, and nothing changes, so alright. So it does say they have the cyst and cellulitis, and they're going to have a cystectomy. So condition under the cyst doesn't say there's an abscess, no bacteria or virus, and it doesn't mention any other existing. I'm going to do the procedure after this. So LO5.91. And you also have the cellulitis. And doesn't specify. code LO3.90. And this is the procedure, cystectomy. Do it like this first. And it is an excision. I mean, it does say ectomy, but it also mentions condylosis were excised, and that's extensive. So it's 11771 for that one. And I think that's it. Yep. Okay.